Hi, welcome to What the Healthcare Podcast, a platform designed to educate listeners by inviting healthcare professionals and patients to share their experiences and stories. I'm your host, Emily, a former nurse and hospital administrator with 25 years of experience. It's been a long road to get here, guys. A long, long road. So during these episodes, you'll hear from current and former doctors, nurses, administrators, patients who have experienced malpractice, and patients who have just had it with the system. We have lots to talk about. I have had several phone calls with potential guests these last couple weeks, and my heart is just broken, especially when talking to all of them, patients who trusted in the system and have been injured. Really speak to me, really talk to my heart. Doctors who have come out of med school with a copious amount of debt and doctors are really the face of the system, and they catch all the slack and they carry the majority of the liability. Everybody likes to beat up on doctors. They're not all bad. I promise you, they're not all bad. There are some that aren't so good. There are. There's a lot of them that are burnout. A lot of them feel stuck. A lot of them to do better, but can't because, honestly, the system truly sets us all up for failure. Doctors, nurses, patients, all of us. So today I'd like to share a little bit about myself. 25 years ago, I naively entered into a career in healthcare as a nursing assistant in a nursing home. I absolutely loved it. I worked in a lockdown Alzheimer's unit. Enjoyed it. I mean, it was truly like not going to work. It was like I was going to hang out with my buddies all day, every day. The patients, my coworkers, everything about it, I loved. And I felt like I was making a big difference in people's lives. And I was excited, eager to learn more, take on more responsibility. I wanted to be a nurse, And so I did. I went back to school. I stayed at the nursing home for a little while, and then I moved on to pediatrics. I worked in an office setting, and then I went to a hospital setting. I did inpatient peds. I liked that too. I definitely started to feel the burnout, though, within about 10 years. So I moved specialties again. That's common. You burn out in one area, so you move to the next, which is kind of a good thing about a career in healthcare. There are many, many different opportunities. So I moved specialties this time to allergy and immunology. This was a private practice, which that's another thing. You can work for a hospital, you can work for a public health system, you can work for private practice. By far, private practice is where it's at. So I went to allergy immunology and moved up to a management position there, clinical management, and then just management. And I started to see the business side of healthcare. I watched decisions being made by people who had zero clinical experience and insurance companies dictating the care of patients. I thought, if I was on the other side, the admin side, surely I could make a bigger difference over there. So I did just that. I took a management position in a hospital and eventually moved up to a director's role. Now, this is where things started to really go downhill for me, because as I was making decisions from a patient-centered perspective, my colleagues who lacked clinical knowledge were making them from a purely financial standpoint. I have to say, as embarrassing as this is, it was then that I finally realized healthcare is nothing but a business, and boy, is it screwed up. And I don't know if you guys have ever heard, nurses eat their young. Yeah, they do. Nurses can't get along for shit. I don't know why that is. In fact, I posted a video on my TikTok one time, and I was attacked by the masses. The nurses, they were all nurses. And I remember people in my comments wow, and actually it was about the fact that nurses do this to each other. And people in my comment section are like, dude, she's right. Look at how they're treating her. This was all over me being new to the platform and sharing my experience. My experience just so happened to be similar to another nurse who was on, like, wow, there couldn't be more than one disgruntled nurse out there. Apparently, she thought I was copying her content. It's the weirdest thing I've ever experienced, guys. I swear to God, it was so weird. But that was a classic example, okay? The same thing happens on the admin side. They hated that I had clinical experience. It probably made them feel inferior, but little did they know, I felt that towards them because they had the business experience that I didn't have. We should have worked together. Why? Because that's the best, that produces the best outcome for the patient. Nobody gives a shit about the patient. I swear to God. Anyway, about 3.5 years ago, I finally had enough. I made the decision to walk away from my career. What prompted this, you ask? Well, we were about a year into the pandemic. And at that point, watching that whole fiasco just sealed the deal for me. I don't know how else to explain it other than watching the money being made, the guidelines changing daily, doing things like reusing N95s, diagnosing patients based on symptoms alone, the incentives that were being given to to hospitals and practices. But essentially, I felt at that point that I had been duped into believing the system was set up to help people, but really it was set up to make money. And I don't fault the industry for making money, by the way. Everybody needs to make some money. But what I do fault it for is prioritizing money over people's lives. So I left. I walked away from a good position, mind you, a 6-figure salary, my retirement, but I left with my morals intact, and that's how I sleep at night. But after I left, I felt lost. I had no idea what I was going to do next. I had identified with my career for 25 long years and had no clue what my next move would be. So I made a video on social media in hopes of connecting with other nurses who may have had similar experiences. And that video blew up. I was also very naive to social media. I guess I was just a naive person, God. But from that one post, I had thousands of patients and nurses, doctors, healthcare professionals alike who resonated with me. I was offered several opportunities, including a documentary. And I almost did it. However, after a couple of meetings with the producer on how I could leverage my newfound platform to financially support the documentary, I backed out. I wanted to build trust with my following, and I didn't feel right asking for money. I also knew if I were to provide information to the public without censorship, I needed to do this on my own. I didn't know how yet, but I knew I needed to do something on my own. And to be honest, I just wasn't ready. I needed to heal. Leaving healthcare was like a giant awakening for me. Up was down, right was wrong. I needed to wrap my head around all of this. And I've spoken to a couple of different nurses recently who share that same feeling, that you come out of that system feeling so stupid, so naive, so just duped, that you have to heal, man. You have to really take time for yourself. I don't know. I guess for me, I could have just continued along had I never gotten to that side of the system and realizing that it's a business and realizing that they're prioritizing money over patients' lives. If I never got to that point, I would have been fine. But once my eyes were opened, it's like I couldn't go back. And I don't know how else to explain it unless you've experienced it, that it's like a disconnect from yourself and your intuition, because you're like, how in the world did I not know this? And then the guilt sets in. You're like, oh my God, how many people did I hurt? You know, of course, not intentionally, but you get out of your body what you put into it. It's become a system where, what are you here for? Here's a prescription. Well, that's not right. It's not helping people. And everybody's so afraid of liability and being sued that, that affects decisions too. Like, it's just, I don't know, man. You just got to wrap your head around it, I guess. I needed that time. I needed time to heal. And I took that time. And what I've learned since being on social media and connecting with people is that many of us, probably the majority of us, have completely lost trust in Western medicine. And rightfully so. patients, nurses, doctors, administrators, I came to the realization how prevalent malpractice is and how the system is setting us all up for failure. The biggest realization for me, though, was the dire need for change. And I'm not sure how we get there. I have some ideas on how we can flip the system, but I know step one is educating the public. And what better way to do that than for us to share our experiences? I recently saw that a group of doctors, I can't remember the name, but they're striking, man. They're talking about, and this is kind of veering off subject, but one of the doctors, actually, I sat in on this meeting. One of the doctors was an emergency room doctor close to where I'm at in North Carolina, and he was fired. He was fired during the pandemic because stood up for something he didn't think was right. I'm not going to go into all details. I'm going to try to get him on here, but there was decisions being made that were affecting patient care. He stood up and challenged it. He challenged the admins, and he was fired. I mean, this is why people are scared. I know darn well I couldn't have stayed in the system and spoken out like this. My nursing license would have been yanked. And I had to get out of the system in order to speak up. You can't do it from the inside, guys. You just can't. Anyway, in upcoming episodes, as we discuss personal experiences of healthcare professionals and patients, you'll learn about the lack of transparency and informed consent, because truly that informed consent doesn't exist. I don't know that it ever did. I guess at one point it did, but if you are not aware of what Rockefeller did to the United States healthcare system, you need to look into that. Specifically, look up the Flexnar report. It's pretty crazy. That's kind of what changed things, in my opinion. I think at that point it became a business. Anyway, you'll learn about the lack of transparency and informed consent, like I said, the absolute chokehold that insurance companies have over doctors, and how that affects your care. Yes, your insurance companies dictate everything. The majority of doctors that I've worked for, the good ones anyway, are always like, if I could go into practice, I'm not taking insurance. Or if we could just do away with insurance, things would be different. Things would be better. The hoops they have to go through, provide good care, it's pretty insane. And, these health insurance companies, if we used health insurance companies the way they were designed to be used, like auto insurance companies, right? You get sick, you have an accident, then you dip in. Otherwise, you pay out of pocket. Things would be so different. Anyway, we're going to talk about your rights as a patient. Yes, you have rights. There is something called the Patient Bill of Rights, and every state also has a separate Patient Bill of Rights. And I'll let you in on a little secret. Many of those rights are violated on a daily basis, and most specifically were violated during the pandemic. For example, the right to visitation. Yes, patients have the right to visitation. We're going to talk about how decisions being made by people with no clinical experience affects patients. We're going to talk about the restrictions that are placed on doctors, which prevents them from having the time and ability to look at you as a person and not the problem you present with or the medications that you're on. We're going to talk about COVID. Oh, yes. We are going to most definitely be devoting several episodes to COVID and how it has changed everything. We're going to talk about Big Pharma and the funding they provide. Did you know that about 75% of the United States medical school curriculum is funded by Big Pharma? Well, now you do. And we are living through the outcome of that. We're going to talk about politics because you cannot talk about change in healthcare without talking about politics. We're going to talk about veterans and their struggle with access. We're going to talk about burnout amongst healthcare professionals and how disposable nurses and doctors are to the industry. That's one thing that was baffling to me when I moved to the admin side. I was like, okay, we've got to take care of our nurses and doctors. We need to make sure that we're taking care of them financially, that we're taking care of their physical and mental health needs. We need to provide good, healthy atmosphere for them to work in. We need to give them the tools that they need to be successful in their positions. I was like laughed at. It's much easier for them work a nurse or a doctor till they just have no more energy left in them, and then replace them. When I was at a private practice in management, I hated hiring new nurses. You want to know why? Because they always wanted more money than what my most seasoned nurse was making, and I couldn't do it. And so I would give raises to my nurses. If I really wanted a nurse, like I interviewed her and she was high, came in at a high price, I would like, okay, well, I'm gonna give all of my nurses raises and then I'll hire her. And my boss, the doctor, hated it. Oh, I got in so much trouble for it, but whatever. I didn't care. It wasn't right to me. Like, it's not ethical. Okay, we're going to talk about the disconnect amongst doctors, even when you are seeking care within a system they are all part of. Because even if you're seeing 2 different specialists, 5 different specialists that are all working for the same healthcare system, you can bet your ass things are going to get missed. Because it's not deliberate, it's the time. I mean, I think when I left the hospital, I was managing 3 different specialties, and they, at that time, had to see a minimum of 34 patients a day. Like, that was their quota. How do you, in a specialty neurosurgery clinic, see a patient and gain a history and connect the dots amongst the other specialties in a 15-minute time slot? Tell me, how do you do it? It's not possible. We're going to talk about the importance of preventative care and good nutrition, because that's a subject in itself. We're going to talk about how to advocate for yourself and family members, and much, much more. I want to thank you all for listening and for supporting me and the guests on this show. If you're interested in being a guest on this show, please send me an email at emily@whatthehealthcarepodcast.com. Thanks for listening, guys. Until next time.